Hi everyone. I will be talking about acute pancreatitis today, and some other videos will be out on this very disturbing disease. But I'm going to start right now with acute pancreatitis and triglycerides. Why? Hypertriglycerides is the first and major identifiable culprit when it comes to acute pancreatitis, and it could be subdued. Yes, could be. Although we'll talk about gallstones and the rest later on, but let's handle this bad lipid and save the pancreas. So let's go. The warning about the triglycerides is that they hate your pancreas. You are becoming a friend to an enemy, or inadvertently you are accommodating an enemy under your roof. Triglycerides hit your pancreas. It's either you treat or you reduce triglycerides to save that pancreas. Please. Triglycerides, the normal value, the normal level is anything less than 150 milligram per DL in countries where they are still sticking to the old metric, or where the SI unit is in place, anything less than 1.7 millimoles per liter. That's what we want. In hypertriglyceridemia, it could be mild when it is between 1.7 millimoles per liter to 2.2 millimoles per liter. We'll not be running around, so we just advise you on diet control and relax. When it is moderate, that is, the value we're reading is between 2.3 millimoles per liter to 11.2 millimoles per liter. I'm sorry I have to stick to the SI unit here, but I'll put up the figures for those who are conversant with the old metric of measurement. When we have severe hypertriglyceridemia, we are talking about anything between 11.3 millimoles per liter to 22.5 millimoles per liter. And of course, that is not the end of the values we could get. It could be very, very severe, in which case is anything above 22.6 millimoles per liter. So when we have that, we know we have something serious at hand. We are not only saving the heart and everything from this bad lipid, but we want to save the pancreas as soon as we can. Increased triglycerides will lead to about 20% of acute pancreatitis, but this number is tripled in pregnant women. So I'm now talking about the bad lipid in pregnancy. And about 60% of all pancreatitis in pregnant women is secondary to triglycerides. Imagine that. If all pregnant women are 100 and they have pancreatitis, 60% of them will be as a result of high level of triglycerides. Hypertriglyceridemia will induce pancreatitis. We cannot overemphasize this, but it could be primary, in which case the genes are involved. Could be hereditary, or secondary, in which case we have problem with lipoprotein metabolism. The primary hypertriglyceridemia could be type 1 or high chylomicrons. And note this could even be present in infancy. and it is autosomal recessive. In other words, the two parents contribute the abnormal genes that is now manifesting in this beloved young individual. Could be type 4 when there's increased very low density lipoprotein, or type 5 when there's increased very low density lipoprotein and increased allomicrons combined, and we call that mixed. Type 1 dyslipidemia can cause acute pancreatitis without environmental risk factors. Okay? Remember I said that is genetic, right? Type 4 doesn't have enough high level of triglycerides to cause pancreatitis. But type 5, which is combined very low density lipoprotein and high levels of chylomicrons, will have similar risk like type 1. In other words, they cause pancreatitis without environmental risk factors. The secondary causes of hypertriglyceridemia will be diabetes mellitus, and in this case, it will be associated with diabetic ketoacidosis, decreasing pH, oh, that's why it is called acidosis, and decreasing insulin. The reason why the glucose level will be extremely high. So there is a possibility of it in medications like estrogen, to those who are taking the pills, olanzapine, those who are unfortunately down with psychotic disorders and they're placed on this second generation antipsychotics, mirtazapine, tamoxifen for the pregnant, for women, clomiphene, for those who are looking for pregnancy, and so on and so forth. Pregnancy, increased triglyceride at third trimester. I just mentioned that 60% of acute pancreatitis in pregnancy is secondary to high level of triglyceride. Alcohol, this is what you can curtail yourself. The greater the consumption of alcohol, the higher the amount of triglycerides. By the time we start talking about acute pancreatitis and chronic pancreatitis later on, you understand better the role, the debilitating role of alcohol in all this. So by the time we'll be talking about treatment, you will see the reason why insulin will become significant. So here I've said diabetes mellitus with DKA with low pH and decreased insulin will give rise to high level of triglycerides. We'll see by the time we want to treat. Yes, treatment of hypertriglyceridemia. Insulin. But you know insulin will shut down the glucose, so you give it with intravenous glucose. GEMFIBROZIL is the drug of choice among all drugs we use to treat high level of lipid. In conclusion, walk over the triglyceride level to preserve the pancreas and, of course, preserve your life. Because by the time we go into details of acute pancreatitis and chronic pancreatitis, you understand why we need to preserve the pancreas. We all need you here. Now, do something about that alcohol. See your doctor, walk over that high level triglycerides. Cooperate, get it solved, and be fine. Thank you for watching my presentations. Be on the lookout for acute pancreatitis and chronic pancreatitis very soon. Thank you.